So wanted to make an update video. Couple things happened. Things are happening really fast because I'm looking at a lot of stuff. Just trying to study a lot of this. Um, Most of the time when I'm laying down and having to rest my joints and stuff, I'm listening to audiobooks on dysautonomia, on vagus nerve, on things to do with prolotherapy, although on prolotherapy and stuff there's really not much books. So basically here's where I'm at. Went to a consultation with a PRP specialist, last week, and got a lot of good information about getting this treatment, getting my neck injected with PRP or prolotherapy. They were recommending PRP as I am super sensitive, and basically in the end what it came down to is that they are actually not comfortable even giving me PRP, which is my own blood injected back into my neck, because of the amount of reactions I'm having and how basically shaken up my immune system is. So that was not something I was expecting. I thought the whole idea is going to come down between me getting PRP or Prolo and trying to evaluate which one has the less chance of damaging me. But it looks like I'm not at a point where I have the luxury to even be taking a gamble on that. So this is how I'm going about it. Basically, I have my symptoms pulled up, and if you look, like, just top 3, right? Can't eat anything. I'm down to 2 foods. Salmon keeping me alive. Hand pain and stuff, okay. Bunch of stuff with joint pain, and then there's head pressure. The one that I have to tackle before I can do some kind of like therapy, like PRP, or fixing my instability and stuff, is going to be after I can get this down. So it's either in the sequence, it's wheelchair next, or it's like apple, basically. Like, if I can get myself to calm down my immune system to be not as dysfunctional and be able to tolerate certain things, and I'm just using an apple for an example, but means I can start eating at least some fruits, some vegetables again, it's an indication that I'm able to tolerate a few more things in my body. Because at the state it's right now, anything, even my own blood, can cause all kinds of reactions, especially if it's something that I am putting near my brainstem. So these can stay. This is what I'm going to be tackling. Having that said, how do we go about this? I've been studying, like I said, a lot, and I had a bunch of screenshots. This is what I've been working on. My girlfriend basically would just sit, and every time I find something really important, as I'm going through the groups of people who had similar procedures or in the same boat, I take screenshots, and I wanted to share these things, but I realized we did something very stupid, which is that you can't see the question. So a lot of these screenshots, I feel like when I read them now, I can't even make out what I originally wanted to take, because we just started screenshotting. Didn't really look at the screenshots, but I might sometime go through this and just kind of clean it out based on the ones that I can tell what's going on. Anyways, so long story short, what I've been finding is that I have something, or I potentially, it's not diagnosed yet, potentially we're looking at something that's called MCAS. It stands for mast cell activation syndrome, and I haven't looked into it deeply yet in terms of exactly how it works, but basically it looks quite complicated within itself in terms of certain blockers that you have in the body, in terms of what chemicals are created, and there's one that's mast cell that's extra created to combat your body it's supposed to normally combat like certain things if certain like certain things you're getting exposed to, or balance it out. I just kind of can't remember what it is, but basically it's supposed to be a limited amount. But people with autoimmune or immune dysfunction can basically, one of the things that they can have, and it's pretty common amongst people with immune dysfunction, is to have mast cell activation syndrome. And like I said, although I don't know for sure, it's as I'm looking through the groups and posting my story and my on my symptoms, this is what a lot of the people are saying. And also one of the admins of these groups, who is like really one of the exceptional people I've ever met in my entire life, like truly just almost like borderline genius for the amount of understanding they have, far beyond any doctor I've ever came across. So it's great to have somebody like that as a leader of a group who's like really helping out people going through this kind of stuff. But anyway, she also said that my symptoms, a lot of it looked like mast cell, where I can't eat anything, everything's like reaction. I can't go near, like soaps, dishes, liquids, smells, intolerance to movement. It's called exercise intolerance, but intolerance to like even jogging or walking or speed walking or walking too much. Intolerance to both cold and heat, and all this kind of like such intolerance overall, from everything from movement, what I breathe, what I smell. Really lately it's coming to the point where even certain movies I have to kind of like be careful, like some fictional characters in a drama, when if it's something chaotic, it gets my heart rate up and I start to feel really uncomfortable, where it's just basically my body can't tolerate any kind of stimulant. Like, anyways, so I went to the ER yesterday regarding one of these episodes that was happening. As usual, they do what they do. Say it's anxiety. They told me I'm perfect. Ironic part this time was, as the person comes back to give the report after like 2 hours, saying that everything looks good, your EKG is fine and stuff. They are telling me, oh, yeah, everything looks good, and then while they're doing it, like I'm having to sign the document and I can't sign. I'm just having so much disorientation. I can't write. It was just such an ironic moment there. Anyways, I digress. Point is, I think this is something that has high chance for me having. So this is the direction I'm diving really deep into, because if I'm able to get this to calm down even a little bit, right, even a little bit, where my immune system starts to become a little bit more livable with, then the hope is I can go and get the treatment for something like PRP or prolotherapy. So as of right now, I'm pretty much denied from getting this kind of stuff, and so that is that. How do we go about MCAS? Okay, so new little unlock is whatever doctors I go for. Now I'm going for people who are pretty much like I start at research level doctors, right? So basically, much easier way to find these doctors now, and I feel comfortable with this. Basically, how I do it is, let's say mast cell activation, and what I would do is look through, and you can see this person gave a talk at a research facility, this society, and it's like a, they're like deep into this, right? And then if this person matches within the groups and people have done work with them, then boom, this is a big unlock. This is the best way to find doctors. This alone is a big thing. So just want to put some emphasis on this. I finally learned how to find best people at a certain direction. You find people who take their stuff so seriously that they give speeches about it, they write books about it, that's their life's thing, that they live and breathe about it. While their advertising sucks, if you try to find this person, it's like hard. They don't even have like their Google page up and stuff like that. Their advertising completely sucks, but they are booked out months and months in advance because of how good they are. And then obviously also in the Facebook groups, people who have similar conditions have used them in the past and can vouch for them. That is also very strong. Maybe that's actually a little bit stronger than even this, to be honest, because that's actually how I got the name. And then when I searched about this, she also came up too, and it kind of like gave me confidence. Long story short, this is the person I'm going with, Annie Maitland, for mast cell activation. But the downside is she's booked out in months. I made an appointment, and on the 12th I have a talk with their one of the junior doctors to get my initial intake and stuff. But she's only going to be able to look at my stuff in September 24th. So some time away from now. And for some weird reason, I feel like just as I'm finding all the stuff, in a scary way, I'm like running out of time, or I feel like that's like what's kind of like coming down to it. As I'm going to ERs each day, I'm feeling a little bit worse. And anyways, so this is what I'm going for, mast cell activation. And then while I'm doing this, I'm also ruling out something called a CFS leak. Where was I? So MCAS and CFS leak. So the reason for this one is basically this one ties into a lot of my similarities with dizziness balance problems, while having like it gets worse when I like lay down, but it gets better when I wake up in the morning, meaning when I have been laying down for a while, which apparently is an indication that I have been leaking for more than 3-4 years or more. Whereas if you are leaking for just short amount of time, couple of months, let's say, it would get better instantly when you lie down. Anyways, without getting too much into it, but basically what this is again, what I'm doing is going and finding out by talking to people, right? So here, talking to people, I'm finding out information about other people who are in the same boat and what they got some resemblance in, and then talking to them and finding out if their symptoms are very close to mine. And by that, then I'm being able to find things that have a high likelihood of having, right? And then I'm finding the absolute specialist in that one particular field, right? I went to my PRP and they have a program to calm down the immune system, right? Before they give us the PRP. I'm not going to take that because that's two different things. If you're a PRP, you do PRP. I want to try to find the specialist in PRP. But if they also have a program for calming down immune, it's okay. Let me find the best specialist for calming down the immune. That's like my train of thought. So this is what I'm doing. This is what I want to rule out. I have a lot of the symptoms that are coming close to this as well. And my hope is between these two, there is some improvement, slight improvement, maybe 10%, 5% of symptoms, which allow me to get the PRP to my neck and for the stability issues that are going on. So that's pretty much it, where I'm at. Wanted to make another video. Yeah, I think this is a good point to stop this because it's pretty much kind of summarizes where I'm at, and then we'll take it from there.